Good afternoon and welcome to the Detroit Regional Chamber's Employer Roundtable, hosted in collaboration with the Southeast Michigan Alliance for Addiction-Free Communities. My name is Cynthiana Lucian. I am the Director of Healthcare Initiatives for the Chamber, and I will help moderate today's discussion. We will explore the critical topic of substance use disorder in the workplace and how we can help employees and loved ones battling SUD. We have a lot of great information for you in store today, but before we jump in, I do want to share a couple housekeeping items. You will see a chat function on the right-hand side of your screen where you could submit questions for our presenters, and I encourage you to take advantage of this opportunity as we move along through the presentations. We will have time at the end to answer those questions during the Q&A portion of the program. So please do so. And now I'm going to turn it over to Nikki Gable from MPHI, who will share some information about the CMAC partnership. Thank you.
Hello, everyone. As Cynthiana mentioned, my name is Nikki Gable. I am with MPHI, and I am a program manager of the Southeast Michigan Alliance for Addiction-Free Communities Coalition, also known as CMAC. We are grateful for the opportunity to partner with the Detroit Regional Chamber on this webinar and also on the initiatives that CMAC is working on. We find that employers have a unique opportunity to reach and assist their employees by providing awareness and links to services to help maintain and reach health goals. But not all of these tools are always understood or readily available, and at times, health needs that have to do with substance use disorder can be difficult to understand or navigate. CMAC has goals of collaborating with employers to understand the needs of their employees and bring awareness and education on substance use disorder to their organizations. And we want to help to reduce the stigma that exists for those to ask for help. We appreciate your time today, as by joining this webinar, you have recognized that your organizations would like to be a part of the solution. And we hope that you find today's discussion helpful to start the conversation internally. At this time, I would like to introduce Michelle Fullerton, Senior Director and Group Customer Advocate at Blue Cross Blue Shield of Michigan. Michelle, hand it off to you.
Thank you. Good afternoon, everybody. It's my pleasure to be here to talk about this very important topic, especially related to COVID. And as many of us return to the office, I think this is a very timely topic. So we'll get started. We'll get to the next slide. So what we're going to talk about today is we're going to review mental health and substance use conditions that we have found that these issues continue to increase in all age groups. I think a lot of people think this doesn't happen with seniors, and it does. And that it's a significant concern for all of our customers, not just in Michigan, but outside of the state of Michigan, and your employees. And that the effects from the pandemic are real, and they're anticipated to affect us for many years to come. And then I really want to discuss what we at Blue Cross Blue Shield of Michigan are doing to address this, and how we are expanding access to high quality behavioral health services and providers, and some of the innovation that we are doing through our collaborative care models and telehealth solutions and crisis services. So we're going to get started. We'll get to the next slide. So let's just talk about the prevalence of behavioral health disorders. Nearly 1 in 5 Americans live with a mental illness. And I really read an interesting stat the other day that said that people who first experience a mental health condition it takes an average 11 years to get to diagnosis and treatment, because so many people do not seek treatment. And that is something that we collectively have to change. But during COVID, I think an awareness and an awakening happened. And overall, there was a 34% increase in Blue Cross Blue Shield members seeking mental health services, and a 38% increase in members seeking substance use treatment from 2020 to 2021. And those are pretty startling numbers. So also, on average, before COVID hit, I would say that the opioid crisis was very prevalent. And we knew right behind it was a suicide crisis. And I would say that now the suicide crisis is right there with opioid this crisis, in that one person dies by suicide every 6 hours in Michigan. And that age spans from teenage to age 80. So and also for every employer, you have to understand that there is a connection between mental health and physical health. And I think many times that connection was never realized. And that's why we talk about now whole person health, because mind and body, there is a huge connection. And it's interesting to note that people who have a primary or secondary diagnosis of behavioral health, whether that be anxiety, depression, schizophrenia, that they have a 2 to 3 times greater spend. Collectively, their healthcare costs are 2 to 3 times greater than someone that does not have a behavioral health diagnosis. Then also, there were over 100,000 drug overdose deaths in a 12-month period between April of 2021 to now, which means there was a 28.5% increase. Now, although we have done a lot to address addictions to opioids or the pathway to abuse through prescription drug use, drug overdose deaths are still happening, and they're happening a lot with the drug fentanyl. And it's not the legitimate fentanyl from a prescription, but from street drug. But that pathway to the street drug is what we need to stop. So let's go to the next slide. We know it's prevalent, and we know that we all have to talk about it. So the prevalence of substance use disorders that we've already talked about, but let's talk about the myths, because there are so many myths. I have heard people say, oh, this just happens to teenagers. Wrong. Oh, this is only an inner city Detroit problem. Absolutely wrong. Oh, this only happens with young males. Wrong. This happens to people who are unemployed. Wrong. This happens to people of lower income. Wrong. Happens to uneducated. Wrong. So all of those things are myths, and we have to myth bust all of that, because it is so wrong. No group, no individual is immune to substance use disorders. And when we look at this at Blue Cross, I would tell you that actually the prevalence is more middle-aged females and in suburbia. So I want people's kind of understanding of this to change, and that we really have to make sure that we get rid of the stigma or anything attached to that, because there is no way to predict who is going to have this issue. So let's look at the numbers. People age 12 or older in the United States, 12, have a substance use disorder or using alcohol, and now legal drug use with marijuana, 20.3 million. And adults have co-occurring substance use disorder and mental illness, and sometimes you don't know what comes first, meaning they have depression and they treat their depression with alcohol, or they were an alcohol misuser, abuser that created depression. So we really have to look at all of these numbers. And I think the last one is most startling. 75% of adults with substance use disorders are in the workforce. I think many people think, oh, these people are not working, they can't hold down a job. That is not true. They are in the workforce. And that's why we are having this webinar, because we really need to talk about how do we help those people. So let's go to the next slide. And let's look at the numbers in Michigan, and this is our real data. So this is what happened during COVID. Our numbers for Blue Cross in Michigan, as you see here, telehealth grew. Well, what happened was, because of COVID, face-to-face interactions did not exist. They were all shut down. So within, I would tell you, 2 weeks, Blue Cross moved from paying for people to go to see a doctor to paying for all virtual care. And where we saw the biggest leap was in behavioral health. And you see the numbers. People were searching for care. Now, as COVID has subsided, it's not gone away, but as it's subsided, I will say that the behavioral health needs, they have maybe gone down a little bit, but we anticipate that behavioral health needs will continue for several years. But the behavioral health and the treatment that was given in a doctor's office has started to subside. But behavioral health with a behavioral health person, credentialed person, is not decreasing. And I wanted to make sure that you understood what does that mean? Marriage therapists, psychologists, psychiatrists, counselors, and social workers. It's all of the above. It's not just psychiatrists. And I think there's a lot of people that misunderstand that as well. So very interesting that we're not seeing the trend go down. And I will tell you that there is a shortage. There's a shortage in Michigan, and there is a shortage of behavioral health providers nationally. We cannot meet the demand. So that is why virtual care is critically important, because the demand is so high. So let's go to the next slide. This shows how behavioral health affected telehealth, right, when we were delivering this through COVID. And as you can see right here, just the chart is very telling. Telehealth really was not that, wasn't that popular. Everybody wanted to go face to face. And then with COVID, the numbers went right up. And in-person care took a deep dive. Now we're starting to see in-person care creep back up, and that's good. But telehealth itself, as you can see, is not going back down. So there is not the reversal. We believe that trend is going to continue. And that's very important for all of you as employers to recognize and really promote virtual telehealth care. I think that's really important, and it really helps from an access perspective. So let's go to the next slide. So let's talk about pandemic and how that affected us with substance use disorder. So the CDC reported that there were more overdose deaths in 2020 than there was in the previous year. Those with substance use disorder are more likely to develop COVID. So that is a comorbidity that a lot of people did not recognize. When we talked about comorbidities and increasing your risk factors of getting COVID, and we talked about people who were overweight or people with diabetes or with high blood pressure and heart conditions, substance use or misuse disorder was also a factor in increasing their risk of getting COVID and actually having downstream medical severity, and their response to COVID was more severe than those who did not have the disorder. 45% of US adults reported that their mental health has been negatively impacted by COVID. And there was another study that said 70% of American workers reported that COVID has been the most stressful time of their entire career. So as leaders and at working with employees, you have to recognize that, and you really have to keep that in check when you're working with your employees. And then last but not least, 13% of Americans reported starting or increasing their use of substance use as a way of coping with COVID-19. And I know there were many wine webinars after work. There were a lot of people that used alcohol and other substances to get through the day. And we really have to keep that in check now, because that is not something that we want to build as a pattern. We need to build resilience by doing other things versus using substance. So let's go to the next slide. So what are we seeing? We are seeing more people, increased isolation because people are working from home. So that remote work has created more of a isolation feeling, more of a disconnected feeling, or the opposite is people don't know when to stop, right? They're working from home and they're still working at 8 o'clock or 11 o'clock at night. And that really is causing issues. We saw, like I said, an increased use of alcohol sales and misuse. This is a Wayne County stat, which I thought was very interesting. But then we know to the right that we have to worry about care. There was a delay of care. In instances, some people were not seeking care or seeking treatment. And now we know that there's going to be a wave of demand for mental health care, and demand and supply. The supply is not there. Nationally, it's not there. And we are doing everything at Blue Cross to try and increase that supply, but definitely there is a shortage. So when people think, oh, I can call and get an appointment in a day, you're very lucky if you can get an appointment in a day. So access to care is something that is critically important for Blue Cross and that we're really working on, but I want people to understand that access right now is an issue that everybody across the country is addressing for all age groups. So let's go to the next slide. So I think this is the most important thing that you can share with your employees all the time. It's okay to be not okay. That's okay. But it's not okay to do nothing about it. And I use this scenario. If I fell and broke my arm, I would do something about it. If I had chest pain, I would do something about it. So let's do something about mental health. Next slide. So as leaders and co-workers, we can do something about it. It's like Smokey the Bear. Pay attention, put it out while it's a small fire before it becomes a raging forest fire. Next slide. So it's okay to not be okay, but let's talk about stigma. So we all should be talking about stigma, and we need to get rid of the stigma. So as an employer, you really need to message anti-stigma campaigns, and you need to do it all the time, not just during enrollment, not just in mental health month, which is next month. So you all should be doing something about mental health, but anti-stigma and that talk should happen monthly with your employees. And that is really important. And the language is important. So let's go to the next slide so we can talk about the language. Okay, so for stigma, I will tell you that one of the most important things is not just what other people say, but personal stigma that people put on themselves. And that is why we need to make sure that people know it's okay to talk about it, right? Because if you don't talk about it and you don't get treatment, then the trajectory is poor. So we need to make sure that people feel supported, that they know they can go get treatment, because the worsening of not getting treatment was bullying, harassment, further isolation, suicide, all of those things. So we really want to nip this in the bud and help people talk about it and get treatment. It's okay. It's okay to feel stress. It's okay to feel burnout. It's okay to feel anxiety. It's what do you do about it? And talk about it. So next slide. I think I'll share this with you, but many of us use the wrong words. Don't be calling people addicts or drunks. Don't say, oh, it's something that you choose, and just, you need to, just pull up your bootstraps and get stronger. These are all wrong words, right? So mental health or behavioral health is a disorder, just like diabetes, just like cardiac disease. So we just really need to change our thinking and our words. Words matter. Next slide. So what are we doing about it? So I will tell you, first and foremost, we need to make sure that we have treatment in every doctor's office. Primary care offices are critically important. They're the gateway. People usually go to their primary care doctor to talk about their stress, their anxiety, their mental health. I feel depressed. So what we have done is we have created collaborative care models where we're working with primary care doctors to make sure that they are addressing mental health in their practices. And hopefully when you go for your annual physical, you will see that. I went for mine and they ask these questions now, which is critically important. So as you can see, we are working to designate practices that are called collaborative care practices, and you will be able to see that on the Blue Cross website as more and more of our practices are whole person health. They're addressing both mental health and physical health. So collaborative care is critically important. In the next slide, we also wanted to make sure that we address access. So we have increased the use of medical assisted treatment, and that is where you receive your medication, but you also receive counseling, and those people get credentialed to do that. We have increased our credentialing and have people providing this care in the state of Michigan. We have 25 new counties that previously did not have MAT therapy. So we want to increase treatment and increase access. Also, we've created what is called the Blue Distinction Centers for Treatment for Substance Abuse. These are nationally recognized treatment centers that have good results, quality results, standardized, and they participate with Blue Cross. We have too many people that are going to non-participating facilities out of state. They see a commercial on late night TV, and I just advise people, do not go to those places. You need to find a place that we know has standardized good results. We'll go to the next slide. Just to know that there are other tools that Blue Cross has, like Shatterproof, and we'll go to the next slide so that I can make sure that you all know of the resources available to you. We are now starting people who get opioids prescribed to them legitimately from their physician for the right reasons. We are also texting them with information about their opioid prescription, about the warning signs of misuse, and actually how fast you can become dependent. Based on the strength of that opioid, you can become dependent in 3 days. So it's critically important we keep people aware of opioid misuse turning into abuse. Okay, so let's go to the next slide. Make sure that you are all aware of bcbsm.com/mental health. This gives all of you as employers toolkits. It gives you information about all the services that one of your employees need or can access. Then this is your resource. And we have this for your employees as well, but I just want to make sure you understand that these toolkits are there for you to use and for you to promote with all of your employees. And the next slide is our virtual well-being. And I really want to make sure I put a plug in for virtual well-being for you as an employer, that this is a weekly webinar that you can attend that helps employers to promote resilience, how to address mental health, build your resilience, how to address anxiety, how to cope. So these are all things that you can promote. And then we have one that's member facing. And you can promote this with all of your employees that can attend real time, or they're also recorded and you can go online and watch them at your own leisure. Really important that I think you offer some of these tools up to your employees. And the next slide. Just that on WebMD, so on bcbsm.com, there's also self-help tools that you can utilize. And I think the next slide is just so that you all know, obviously Mental Health Month is coming up. In 2021, we had a huge anti-stigma campaign, and we will be doing that again. So we invite all of you to promote anti-stigma in the month of May, but I want you to promote it every month. And make sure this year that we are really going to focus on the LGBTQ community and also African American community. So there are a lot of tools I would tell you NAMI is another great site. Brene Brown is another check-in, two-word check-in. So I really encourage you to do things with your employees and teach everybody that it's okay to talk about this and promote it with all of your employees. Normalizing this will then reduce the stigma for people to get the help that they need. Next slide. I think that is the end. And I turn it back to Cynthiana.
Thank you, Michelle. That was such great information. Just, the correlation between mental health and SUD, talking about stigma. We're definitely gonna, explore more of these topics, and we're excited to bring you back for the Q&A in a little bit here. So before we do that, we do have one more presentation, which will be focused more on the employer strategies. So it is my pleasure to introduce Dr. Brian Spitsbergen, Vice President, Behavioral Health at Work at Health. Brian, thank you for being with us, and we're excited to hear more about what you're going to share with us.
Great, thank you, and good afternoon, everybody. And thank you to Michelle as well. I think that was excellent information, and I know that we talked a little bit about some of the statistics, and I just wanted to highlight that I think that the discussion that we had about stigma is extraordinarily important. I'm actually a person in long-term recovery myself of close to 36 years, and we have continue to have a long way to go regarding stigma. And with this population, one of the things that is extraordinarily important to know is that often people have had poor experiences prior to looking for or considering or even becoming interested in help. So it really is, our duty and our responsibility as stewards in this field to understand that while we may recognize that someone might have a problem and looking for solutions, that it might not be as simple as just recognizing the problem, because as a system, we continue to have a long way to go to get better to the point that Michelle had made, for example, with other kinds of diseases or conditions that affect our society. Mental health, and particularly substance use disorders, are extraordinarily stigmatized, and people oftentimes draw on a lot of personal experience to make decisions. So I think as we move forward in this discussion, moving away from that perspective and into, how do we recognize it? What can we do about it? Becomes extraordinarily important. And we discussed a lot of the statistics here, so I'm going to go ahead and say, let's move to the next slide. I do want to talk about kind of in the workplace a little bit, take a little bit of a deeper dive there. When you think about the cost, sometimes we don't always think about the real cost, and of course there's a dollar cost, which you can see some of the numbers there. I'm not going to highlight them individually, but what I'm going to say is that when we're trying to manage and grow a business or work with people in groups or teams or stuff like that, substance use disorders have a significant impact, not just on dollars and cents, but on growth, on morale, on interpersonal relationships, on things like having people be able to get along or even be on the same page. And you can see in some of the statistics here even that we're talking about everything from job-related performance issues to accidents to people being in danger depending on the kind of work that they do. We've referenced a lot of the statistics regarding some of the substances out there, and know that it's always evolving. And I think some of this was hit on earlier about drugs as if you took a fentanyl, for example, fentanyl as we know it today is different than it was 3 years ago, which is different than the opioid crisis as it developed years before that. And we're seeing some of the same issues, regarding methamphetamines and other kinds of substances that are kind of coming into the forefront. You know, we also have substance use that's going to be looked upon differently over time as it pertains to, you know, as we've relaxed our, you know, our outlook on THC and cannabis, or microdosing with hallucinogens, which is now becoming a practice that's being looked at for depression and anxiety in the psychological realm. So, you know, there's always things in the workplace that are constantly going to be evolving, and then there's going to be the things that we already know and that we already see. And we can move to the next slide. So, you know, when we think about helping people, there's a whole lot of benefits to having recovery solutions in the workplace. You know, obviously there's a cost savings, but some of the other cost savings that, as you know, being in the field of helping people, but also you know, working in an organization, we know that, you know, it isn't just the cost of people missing work or people reducing productivity, but it's also the fact that when we are consistently having to train and retrain and bring in new people all the time, that also affects production and performance. So there really is, you know, to me, the idea that if we can help support recovery, actually folks that are active in recovery and are working at their peak performance will do amazing work. You know, it probably in a lot of ways exceed expectations in terms of what they can do, depending on how long they've been in recovery and the steps that they've taken to get better or get well. But we'll hit all the benchmarks, right? We'll talk, you know, it'll reduce absenteeism, it mitigates risk, really creates a better environment for all, and honestly, probably a more cohesive and harmonious one at that. And we can move on to the next slide. So I think it's important just to kind of put a framework out there so that everyone understands, yeah, and Michelle referenced this terminology, and that words matter. And so the official term that gets thrown around is substance use disorder. It's kind of the official title that people have given it now. We know in society that we commonly refer to it as substance abuse, addiction, alcoholism, addict, alcoholic. We do have to understand that these terms do have meaning and value, and they do have, you know, the words do matter. What I wanted to kind of frame out is just maybe provide some very basic kind of concepts as to what addiction is in general. I frame it as addiction only because substance use disorders are pretty all-inclusive, meaning that whether you drink, whether you smoke, whether you inject, whether you digest, you know, pills or whatever, it really, there's some outcomes that are pretty consistent. And so the framework around addiction and substance use disorders, to me, is looking at what are we dealing with? Are we dealing with a person that's misusing? Are we dealing with a person who's physically dependent? Are we dealing with a person that is emotionally invested in this and chases drugs and alcohol? But in its simplest terms, we're really talking about two things. We're talking about progression, meaning that did their use over time increase? And we're talking about tolerance. At some point, did their use change over time in terms of amount? Addiction, substance use disorder, is recognized as a primary health condition, and Michelle had referenced this in some ways. It's viewed upon in the medical community as a legitimate primary condition on its own. Most of the time, it doesn't exist on its own. It probably, majority of the time, usually I think the number that gets thrown around is 3/4, somewhere around 70% of the time, people with a substance use disorder or addiction would have an additional mental health issue. Certainly probably going to have some physical concerns depending on whether they're in that misuse or other categories. I like to frame it out in terms of stages. If you think about cancer, for example, if I was able to kind of do a show of hands of everybody in the room and ask how many people are aware that there's 4 stages of cancer, probably 80% of the room would raise their hand. But when I ask if people are familiar with that there's 3 stages to addiction and substance use disorders, it seems like hardly anybody raises their hand. And the reason for that is that part of the stigma of substance use disorders and addiction is that people can recognize the latest stage. They can recognize physical dependence. They can recognize when somebody's really bottomed out. They can recognize when a person is pretty much lost it all, and physically you can see it, it's visible, it's easy to recognize, and the consequences are really severe, loss of career, significant jail time, severe health issues that may lead to death, all kinds of, I've been in this field for over 30 years, and I've worked with probably, I can't even imagine how many people who have either overdosed or died, or had seizures because of alcohol use disorder, for example. Those are physical symptoms that liver disease that are easily recognizable and out there, but there are stages that we can recognize before that, that where we can still be helpful to people in a place where they're still amenable and maybe even willing to do some things. And that's important, and this is just kind of a personal thing for me, but when I say that, we talk a lot about people gotta want help to get help, and I think what's probably more accurate is we need to know what people are willing to do in terms of getting help. I would refer to it as, on New Year's Eve, people make resolutions all the time that they're going to get healthy and they're going to start going to the gym and they want to lose weight, but then they go for a few weeks and then they kind of let their gym membership lapse. We can want things, but there's a big difference between wanting them and what we're willing to do. So hopefully, as we kind of work through this, we can just briefly touch on how we might have conversations about that. So we know that this disease is progressive, chronic, and fatal, and can lead to decline in all the conditions I think Michelle referred to earlier in her presentation. So we can move on to the next slide. Thank you. So just highlighted some things here in terms of substance use disorders in the workplace, things to look for. I'm not going to read them all off, but some of the things that I think probably would be key to highlight is, we look at things that really start to affect performance, right? Because performance is the one thing that's pretty easy to look at. So when we have individuals that start having personal issues that override work responsibilities, when they're having financial troubles and it's kind of bleeding into the office space, when they lack awareness to inappropriate behavior, they're obvious things maybe like late or no shows, erratic behavior, conflict. Any one thing by themselves doesn't necessarily indicate a substance use issue disorder, but when you start to look at groups of these things, you can start to make some connections with this in terms of identification. And one thing I'd like to add to that before I move to the next slide is that one of the key things that we can see with people when they start to develop a substance use disorder is they lack a sense of remorse when they start to get into trouble, so to speak, and have a tendency to look for ways to deflect some of the conflict and difficulties and problems in their workspace. So we'll move to the next one. And so, it's important to note that if we're thinking about talking to somebody about this problem, that we, if we're an employer or a manager or somebody that has somebody on our team that might be struggling with this, it's certainly important to know policies and within your organization, kind of how that works, recognizing that this conversation is, if we want it to go well, and we want to help the person, that we have to be very strategic in our thinking about how we would do that. If we run under the assumption that for most people, this is a very difficult conversation and something that they're probably not very comfortable with and are certainly aware of the stigma, then it might make sense to be discreet about how we approach this, and maybe, make an appointment that's, certainly out of the earshot of other people and more of a private conversation that we understand from a position of trying to be helpful, that we know what we're trying to accomplish, and that we're really, trying to open the door to a conversation about how to help somebody, and that we're doing it in a discreet, confidential, and helping way. So we need to understand kind of emotionally where we are, and certainly how the other person communicates and what that style might look like. So we can move to the next slide. So we got to remember how we approach this definitely matters, because we know it's not easy. And language, as Michelle referred to, is extraordinarily important and with dealing with these sensitive issues. And it's important to know even what we don't say can be as important as what we do. So we have to be really thoughtful about what we're trying to accomplish, like I said earlier. We can move to the next slide. So for example, things not to say is probably coming right out and thinking and saying, hey, I think you got a drinking problem, or you're an alcoholic, or hey, you should just kind of like Michelle mentioned, pull yourself up by your bootstraps or get a hold of yourself, because those are things that create what I would call a defensive posture or dynamic with another individual, which is the last thing that we would want to do if we're trying to be helpful. We can move to the next slide. What might be helpful to say is this may be a difficult conversation, but I certainly want to share some observations with you. I have some concerns that I'd like to discuss with you, or my goal today is to identify a plan of action to support you. I think that the supportive stance and the helpful stance can be extraordinarily important and helpful. Generally speaking, people that are struggling with this issue are going to feel kind of out on an island. And social support and advocacy is huge for people with substance use disorders. It's a huge thing to have an advocate and somebody that's looking out for you. And oftentimes I've found and noticed and certainly experienced in my own life when that person checks in with you and you kind of have that moment where you're like, wow, I need to do something about this. There's a sense of loyalty you feel about that somebody actually cared enough to do that. So you really, that conversation is extraordinarily important, because it could be a pivotal moment in changing that person's life. And we'll move to the next one, which I think is the last one. And I just wanted to point out that kind of in conclusion with that is that it would be amazing if everything goes well when we have that conversation, but most of the time things are not going to go well in a one-off conversation. It is absolutely normal human behavior for all of us to have built-in defense mechanisms, and whenever we're feeling like we're challenged or being brought to task for something or feeling afraid, our defense mechanisms pop up. And if somebody truly has a substance use disorder, one thing I can kind of say in conclusion is that you're going to be dealing with a person that's been living in their defense mechanisms for a long, long time, and they're very practiced at it, and it really becomes part of who they are and what they know. And part of their recovery is kind of undoing that. If this issue was simple enough just to set up, get people off of something, then we could have had this problem solved a long time ago, which is set up detox facilities and send people on their way. Part of recovery is really about helping people find solutions to chronic problems that go on in their life once they put down the drugs and the alcohol. And part of that is kind of unwinding those defense mechanisms and helping them be able to identify and problem solve in an effective way. So this is certainly a natural part of the process and something that's very important. I'm going to conclude there, and thank you everybody for your time.
Thank you so much, Brian. And I would like to invite Michelle back at this time as well. We're going to continue the conversation. We have quite, a few questions from the audience. And I think what's, important about this topic, that it really touches everyone. You know, whether you're a person dealing with SUD, you have an employee, a family member, a friend, someone in your community, I think, you know, we can all learn strategies on how to have these conversations and, you know, help each other out to get the treatment that, you know, we all deserve. So I'm going to go ahead and jump into our Q&A just to be cognizant of our time. A really good one that came through. Most employees are afraid to speak up or report substance use disorder issue, which, you know, I think it's pretty common in the workplace. You're, you know, whether you just, it's a sensitive topic, you're just, you might be afraid that your employer may, you know, you get punished for it. So what can you share to ensure that people feel free to speak up for either themselves or their coworkers when a substance use disorder is identified in the workplace? And I'll start with you, Michelle, on this one.
I think some of this is really stigma once again. And I think Brian did an excellent job of how you talk about this with somebody. And it's using I statements and coming from we have to come from a place of understanding and empathy, and that then hopefully that fear will be minimized. I think as leaders in companies, if you can share stories, if you can disclose maybe your own personal, I think sharing stories is very, very pivotal, and it makes everyone seem human. When you share, if it's been in your own family, if it's been someone in the workforce, but sharing that story and sharing how you can support people through that, hopefully that will reduce the fear. But I think storytelling and sharing is a way to do that. Brian?
That's a great point. And I think also, you know, if you have leadership, right, adopt those strategies and be open about it and talk about, you know, SUD and the importance of getting treatment and getting support. So thank you for that, Michelle. Brian, I'll turn it over to you.
Yeah, I would just add, I think organizationally, there are organizations that are probably afraid to touch this issue too, because, you know, maybe from their standpoint, there's a liability depending on what they do. I would say that the problem there is that if there's solid organizational policies about not, you know, a person not feeling like they're going to be punished for coming forth, I think that helps. I don't know that necessarily if you're struggling in this space that a policy is going to be enough. I wonder if, you know, in that sense, you know, if you're a person trying to help and you feel that you're on solid ground with the organization, that it's not going to punish, then I think, you know, maybe that's part of that initial conversation, creating that, I guess in summary, creating that safe space, because I think that safe space is something that people generally, you know, they just wouldn't see that as even being a possibility.
I can add that for employers that have EAP, I would say that so many employees view EAP as a place that you go when you're in trouble. And it's so much the opposite. And it's confidential. I will tell you at Blue Cross, I mean, it is confidential. It is not shared. Personal, I mean, I've used EAP and I tell all of my coworkers and employees to use it. I think we talk about EAP, maybe we talk about it only during open enrollment. I think people only think about EAP when they need it. So I think you need to talk about EAP and that it's there and it's confidential, and no employer has access to the information through EAP, and really make that message a regular message to your workforce.
I think, you know, EAP is so critical, and a company sharing those benefits with their employees And like you said, I think there's that fear that's always there. Is my employer going to find out, that I'm speaking to a counselor or what I'm talking about or whatever it is? And no, you're right, it's completely confidential. So these are all benefits that employees, can take advantage of. So kind of going on that, Michelle, there was one thing that you said during your presentation that really just caught my attention, that it takes 11 years for someone to get treatment from the time that they're experiencing symptoms. And, kind of going on what we were talking about, how do we normalize these work? I think you shared a little bit about it, both of you did, but how do we normalize the conversations about, utilizing EAPs, about talking to your manager if you're struggling, about talking to a coworker for support? How could we get one step further and reduce the stigma?
Well, I'll take the first attempt at this, and then Brian, I'm sure you have some really important information to speak to this as well. I just came off a Blue Cross webinar that we were doing this with all of our employees at Blue Cross, and what we're trying to do is making sure that as leaders, but also as coworkers, right now, as we come back from COVID and come back into the office, that we check in with each other. We IM each other and say, hey, how are you doing? Not even work, just how are you doing? I love the Brene Brown. I discovered Brene Brown as, she's on TikTok, she's on Facebook, but just they talk about this 2-word check-in that every leader could do at the start of a meeting. Hey, everybody, 2-word check-in. How do you feel today? I feel anxious, or I feel anxious, but I also feel focused, or I feel stressed out, and I can't handle things right now, right? Like, I think that even gives a sense of connectedness to one another, but really to check in with people. And then I say the next thing is to give people resources like NAMI. There's on website Mental Health First Aid that anybody can go learn about mental health. I think Brian gave some very important information. I just think we have to normalize these conversations, and that will help people when they're experiencing these emotions or experiencing these situations, that they will build resilience, hopefully, but they will also talk about it. Talking about it is where it begins, so that you can get the help that you need.
That's great. Very powerful. Brian, do you have anything to add?
I think that was well said. The only thing I would add is we spend, a significant portion of our week at work one way or another. And so work becomes a de facto family. And if the family's healthy and can communicate, then it works. If the family's unhealthy and doesn't want to communicate about it, it doesn't work. So.
And really, this is, something that's not going away. I mean, we've, mental health has always, been a challenge for some people. And I think, COVID has definitely, increased that, and substance use disorder. And it's here to, stay until we do something about it collectively, right? So, I want to get into a little bit of your predictions for the future with substance use and behavioral health trends in the workplace. After COVID, or at the tail end of COVID. I know that we're, kind of in this more kind of, COVID's kind of getting, in a place where it's a little bit more manageable. But what if, what do you foresee for the future? I would ask.
Well,
Okay, go ahead, Michelle. I'll follow you.
I just read an article this morning. Wave 5 and 6 is in South Africa right now. Like, here we go. It's coming again. We're not done with COVID. COVID is something that we are going to be living with. There's going to be waves. There's political divide over this. There's anxiety. I mean, this really is a health crisis. And I think the anxiety and the stress that COVID has brought is going to be with us for years to come. I think there is a mental health shortage, so there's also that stress. As a parent, I will tell you right now, our youth and adolescents, access to care for youth and adolescents is nationally at a crisis level. We have kids waiting in ER for placement for 10 days before they can get in, for treatment. This is stuff that we all collectively across the United States are working to address, but we are at a crisis situation. So that's why we have to talk about it. We have to try to get help when it's at the stress, anxiety, burnout level before people turn to other coping mechanisms that Brian's talked about that are not good. What are the triggers that are not good that bring you into the spiral? So I think the outlook, I'm hopeful because I think our younger generation is more willing to talk about this than my generation was. And I really have a lot of faith in our youth, but I do think that it's going to be a tough couple of years, the next couple of years.
And I'll just add that I think that the indicators that support, you're probably having a generation that for the youngers, you have a generation that's going to have a whole different outlook on anxiety and depression because of, lockdowns and changes and disruptions to their development. But that isn't just, and I think that there's plenty of supporting data to look at that. I think we are in a crisis of needing people that can practice on the front lines to help alleviate that. And I agree. I don't know that it's there. If we even took the slice of substance use disorder and looked at the education around us, like substance use disorders in the practice or in the educational field right now for counseling, social work, and psychology. I mean, there's really no mandate that you have to learn a significant amount of information about that coming into the field. Working with adolescents, as I did for 25 years, is not something that a lot of people are frightened away by that. Same thing with seniors, which I had some experience with that. We also have a manpower situation that requires some different tactics in terms of getting people prepared to be able to help people. So.
Yeah, and I think this conversation is something that, needs to continue in organizations, needs to continue in households. I mean, like both Michelle and Brian stated, the stress from COVID is here to stay. It's going to have an effect on us for the long run, and we really have to take care of each other. So unfortunately, we're coming up to time. I know we could probably talk about this topic, for another hour or so, but I do want to give each of you an opportunity to leave our audience with, some last minute advice, whether they're struggling with substance use disorder or someone in their lives is, or if they're an employer trying to support employees, what advice do you give them? Brian, I'll start with you.
I think that not waiting, reaching out, finding resources. I think resources has been mentioned a few times. The immediacy of getting help at the moment where people are at is extraordinarily important, because sometimes that desire and that willingness will pass very quickly. So.
Thank you for that. Michelle?
I would say, if there's one thing you can tell your employees, your family members, your friends, it's okay to not be okay, but it's not okay to not do anything about it. You would take care of your broken arm, you would take care of your diabetes, you got to take care of your mental health.
That is, both of your statements are a perfect way to end this conversation. And, I want to say a big thank you to MPHI and CMAC, Blue Cross Blue Shield of Michigan, and Work It Health. Thank you to Brian and Michelle. I think we all learned some really wonderful strategies. We will be sharing the slides with you, so you will get those. I know that there were some questions around that. So I think we just encourage you all to, open up and have those conversations about mental health and substance use disorder. and together we can end the stigma. So everyone have a good rest of your afternoon, and we will see you at our next discussion.
Thanks, everybody.